Tell us very quickly, as I've gotten some information on this recently, about the Social Security issue. So people that don't decide they're going to opt out.
Right.
Go through that for everybody.
Okay. And just recently, the federal government put out a paper about how Medicare and the exchanges, or Medicare and healthcare.gov, or Covered California, or the state exchanges, how this all works together. Here's the fact of the matter. Many years ago, the administration decided to put into a rule book called the Conditions of Participation, and they put into that rule book that if you choose not to have Medicare Part A, you do not get any of your Social Security benefits. So you turned age 65, you like your private insurance, you understand that Medicare can actually ration your health care, you don't want to even have it any part of your life, then you lose all access to your Social Security benefits for all the time that you worked. You don't get them. Well, let's just say you're 70 and you decide, okay, no, you know what? I'm getting out of this Medicare A program because whenever I'm in the hospital, they seem to be reticent to give me the kind of care that I need, so I'm getting out of that. I'm going to stick with my retirement policy, and that's all I'm going to have. Well, then you not only lose your Social Security benefits at that moment, but you have to pay back any Social Security benefits you have received and any costs that they have provided for you through Medicare. You must pay it back. There was a lawsuit about this, and unfortunately, in January of 2013, the U.S. Supreme Court decided not to take it up. That was a fatal flaw on the part of the Supreme Court, because this requirement that you lose your Social Security is not a law. It's not a rule that ever went through the process of rulemaking, which would have required them to get public comment on it. They just decided it and put it in as a requirement, and they still maintain that they can do it, and the judges said that they could do it, and that's why the plaintiffs went all the way to the Supreme Court, and the Supreme Court didn't take it up.
Wow. So
here we sit with everybody being trapped in Medicare unless they're willing to lose their Social Security benefits. So that's just a reality that people don't know, and that needs to be challenged again. Here we are at the moment. The other thing people need to know is, well, why would I want to get out of Medicare? Well, because Medicare says in a law by Congress in 1997, if Medicare denies you access to covered care, so like a CT scan, for instance, or a hip replacement or whatever it is, but it's actually covered, but Medicare and their health plan that they're using to administer it, they say, no, you don't need it, or we're not going to pay for it, or you're too old, or whatever. And then you say, well, that's fine. I'm going to pay my doctor to get that CAT scan. Well, the law in 1997 says that if your doctor takes the money, your doctor can be convicted of fraud. Your doctor will not take the money. And therefore, your health care can be rationed through Medicare, and your cash is good for nothing unless you go to a doctor who does not take Medicare and happens to be the specialty that you need, or you leave the country.